Okay.
Good morning, everyone. My name is Swamy, Special Projects Coordinator at Lyft.
I'm Cade. I'm the Marketing Coordinator at Lyft.
I'm Noor, I'm the Financial Coordinator at Lyft.
I'm Jeannette, Umanzor, and I'm the Fundraising Coordinator at Lyft.
We're with Lyft and are partnering with Comfortree to bring you our program, Krusin'n'Kleann. Everyone, listen very closely. I'm about to tell you all an important truth. Look at the people sitting in your row. About 3 of you from each row will be hooked up to a dialysis machine within the next 30 years. Neither I nor a seasoned medical professional can tell which one of you or how you may get kidney disease. That is the severity of the crisis afflicting our nation and especially our city. He's no Captain America and she's no Black Widow, and we are not the Avengers to save everyone's lives. But we firmly believe that the program we have created will improve the lives of many dialysis patients and increase their chances to live. Let's step back for a moment and try to understand what kidney disease is. How many of you had a hangover and say the last name? It's fine, just keep me honest though. So just as you're chugging down that last glass, kidneys were hard at work trying to filter out all the alcohol from the bloodstream. So it's safe to say that our kidneys are a special type of filter in our body. In addition to filtering out metabolic waste, our kidneys also maintain a delicate balance. But filters do get dirty. Take AC filters, for example. We have to change them every 3 months or so. But our kidneys, on the other hand, are meant to last a lifetime. But due to several factors such as hypertension or diabetes, our kidneys lose their filtering capability over time. People whose kidneys filter less than optimally for 3 months or longer are diagnosed with chronic kidney disease, or CKD. Sadly, the woes do not stop there. CKD only gets worse. It can be split into 5 stages, with each stage defined by how well the kidney can filter. The last and most dreadful stage is called end-stage renal disease, or ESRD. Patients at this stage, and the chilling truth is many CKD patients will get to this point, need to undergo dialysis or receive a kidney transplant just to survive. About 26 million Americans have CKD, but the most frightening part is many of them don't even know. First, Ebola, and now Zika are 2 important diseases in the spotlight. CKD, however, is here, now, and affecting our fellow dialysites. The most alarming fact from the National Kidney Foundation is that the prevalence of ESRD in Texas is higher than the national average. So, in this graph from the Texas Health Status Report, the CKD shows no signs of slowing down. The incidence rate, which is the number of new cases, and the prevalence rate, which is the number of actual cases alive, is seen to be rising. And then on the table to the right from Texas Tech University, Dallas has the second highest number of CKD cases in Texas. And CKD seems to affect people below the poverty line more than any other demographic, as is shown by this graph from the Society of Nephrology. After analyzing all of this data, we decided that we cannot tackle CKD head-on, but rather help those people struggling with this disease. I would like to note that Medicare does not consistently cover for transportation to and from dialysis. And since low-income patients suffer the most by missing appointments due to unreliable transportation, it became clear to us that the problem we needed to resolve was a lack of affordable and reliable transportation to and from dialysis centers. Then, the next obvious step seemed to be the implementation of a free ride service, which even the Community Transportation Association recommended to the U.S. Senate during a testimony. According to Infection Control Today, dialysis patients have an increased chance for infection. So, as an added benefit to our program, we're providing our patients with a free home cleaning service, since many dialysis patients are unable to look after themselves after a long time. And then here are the solutions that I just mentioned to you. And now Cade will talk to you about objectives and involvement.
Thank you, Swami. Like he was saying, chronic kidney disease patients tend to have problems with their day-to-day tendencies, cleaning their own house, and transportation to the dialysis center to get treatment. So with Lyft and Comfortree, we're going to combine and make Krusin'n'Kleann. What Lyft is a personal taxi service, pretty much like you and I. We could become a personal taxi driver. Lyft was made back in 2012, established back in 2012 in San Francisco, California by Logan Green and John Zimmer. They had the bright idea whenever they were working for a ride-sharing app, which connected Facebook users with mutual friends to get personal taxi rides. And then Comfort Tree is a nonprofit organization. It is established back in 2009, provides free house cleaning services to anybody. We provide maid services here in Dallas, have provided services with many volunteers to just go into houses and all that stuff, clean, all that stuff. So, Krusin'n'Kleann, that's who we're gonna be, combining both of those two. What we're gonna do is we're gonna get our patients, and so we're gonna, as Lyft, we're gonna get our patients' schedules, times, and all that stuff. Lyft drivers, whenever they're signing up, we're gonna get their time and locations, and then Comfort Tree volunteers their time and location as well. And this is just gonna be all one big circle. As the patient gives us their time, the driver will then get their time, meet up at the house, and as that's going on, the Comfort Tree volunteer will then get in contact with the patient, and then they'll all meet up at the house. And as the Lyft driver and the patient go to the dialysis center to get treatment, the house will be cleaned by the Comfort Tree volunteer. And I'm going to hand it back to Swami to tell you our goal in the next 6 months.
Thank you, Cade. At first, it was difficult for us to determine how many people to help through this program. After studying the resources available to us and looking at schedules of various dialysis patients, we arrived at the goal of helping 120 patients in 6 months. Given how dialysis works, we believe 120 is an optimal number to effectively help our patients and to start off our program. Using city data, I determined 3 Dallas zip codes with the highest number of people below the poverty line. Those 3 zip codes are shown here. As I said before, ESRD is linked to poverty, so we believe patients from these 3 target areas will benefit the most from our program. And the dialysis center equidistant from all 3 zip codes is DaVita Dialysis, downtown Dallas. We believe that our drivers will benefit from the short commute from the patients' houses to the dialysis center, and our patients will appreciate the convenience of going to the dialysis at their own time and without the hassle and avoiding the hassle of public transportation. And here's a map of the 3 Dallas zip codes, and the star shows the location of the dialysis center. And now Noor will talk to you about finances.
Thanks, Noor. My name is Noor. I'm going to be talking to you about the budget for our project, Krusin'n'Kleann. Our expenses are split into 3. The first one is supplies, which is the supplies that Comfort Tree use to clean the houses. Comfort Tree doesn't pay the volunteers or reward them in any way, but they still have to pay for the supplies used to clean the houses, which is $70 per house. And since there's 120 patients, that means we're going to be cleaning 120 houses, which will add up to $8,400. Our second expense is the employee compensation for Lyft. We're going to be paying the drivers that sign up with our contract $20 per ride. It's just a reward, and that's going to be $4,800 because 20 drivers and 20 rides, and then there's 240 rides because 120 rides to the clinic and then 120 rides back from the clinic to the houses. Our third expense is marketing and advertising for our project because it's a new project that no one has ever heard of, so we need to raise awareness. And we're going to be doing that by renting booths at healthcare events, and marketing and advertising by using newspapers because we're targeting an older age group, but we will also be using social media. And that's going to add up to $10,430. So, as Cade said, Comfort Tree is going to be there. They're going to arrive 15 minutes before the Lyft drivers arrive to clean the houses so they can be let in by the patient. And then the Lyft driver will arrive and pick up the patient to the clinic, and then the closest driver to the clinic will drop the patient back to their houses. We're going to be requesting $11,815 from the Dallas Chamber of Commerce, and we're going to fundraise the rest of our expenses. This is a 6-month period project, and due to our success, we will think of expanding. Oh, sorry. Oh, thank you. Sorry.
Thank you. Marketing. We're as Lyft drivers will have our Lyft drivers will have 10 brochures in their car at all times, so they can communicate with their drivers, strike conversation, and who knows, they could one of their family members or even themselves could be chronic kidney disease patient. Also, we're going to go to health fairs, have booths with stress relievers, pens, pencils, brochures, just to show awareness with a banner on our booth. As people walk by, they'll see us. We'll pass out the brochures and pencils, and maybe there'll be a chronic kidney disease patient or a family member. Also, the health clinics, we're going to have brochures and surveys there. Maybe fill out questionnaires there, buy the sign-in sheet, maybe distribute them among the employees there, give to their patients, show awareness. And also, we're going to be doing the Lyft app. We're just going to have a big banner within the app. You can click on the banner once you get in there, fill out our questionnaire, all that good stuff. And we're also going to do, like she said, in the Dallas Morning News, we'll have a flyer there, also in the Star Telegram, and then we're also going to be doing Twitter, Facebook, Instagram, hashtag Krusin'n'Kleann to promote awareness. Now I'm going to hand it to Jeannette for fundraising.
Okay. So Lyft already gives to nonprofit organizations through a project called Lyft for Good. The program tries to promote the values of empowerment, impact, and local commitment. So our fundraising efforts will be an extension of that. Our three main fundraising will be through taking percentage fees of the rides, collecting matching grants, and volunteer grants. For a percentage of the rides, Lyft will donate 5% of ride fees to the cause after the driver's fee has already been distributed. For matching grants, that will be based on donations. So Lyft drivers can pledge to donate a percentage of their tips to the cause, and our sponsors will then match the total dollar amount. Included with the matching program will be any donations given by individuals. And finally, we have the volunteer grant. This will be based on the total number of hours that Lyft employees volunteer. This can be done through volunteer to drive the patients to and from dialysis without collecting any sort of fee. The hours committed by these drivers will then be given a volunteer grant. Also, to promote volunteerism in the community, any employee of Lyft that volunteers within the DFW area, their hours will also be included and given a grant. So, in summary, chronic kidney disease is a horrible disease that affects many of the lives of people in the Dallas area. Although our program does not intend to single-handedly combat chronic kidney disease, we do intend to simplify the lives of people that suffer from it. Krusin'n'Kleann will provide the consistent and affordable transportation that these patients need in order to remain in good health. And then through the program, they will also have their homes cleaned so that they can avoid infections due to the lower immune systems. Through the success of the program, we hope to not only raise awareness about this disease, but also expand the larger geographical area. Once the program is solidified, we do hope to establish permanent funding and autonomy so the patients that do go through this don't jeopardize their lives because of something